Health Check is brought to you locally by Island Cancer Center.
And thank you for having us here. We're from the Medical City in Ortigas in Manila, and it's the sister hospital also of GRMC or Guam Regional Medical City. Um, you would always hear of people going to the Philippines or people going to GRMC or in the other facilities here with symptoms already of a certain disease, right? A heart problem, diabetes, someone getting screened for cancer. But it shouldn't be that way, actually. It should be um, you are to be more proactive in doing, shall we say, health checks or wellness checks. You get to be screened on a yearly basis, on an annual basis, on your present state. And that's the best way to actually catch the diseases early on for you to have a better prognosis of certain disease, right? So you would always hear of executive checkups happening. I visited the Philippines for my executive checkup, which is the best way to actually be more proactive in taking care of your health. And we provide that in the medical city and in such a way that um, we have a close connection with the primary care physicians here, the facilities here in GRMC. So we have, in a way, a continuity of care kind of a relationship wherein we have doctors from here who would also see you in Manila. So they see you here, but they also get to manage you when you're in Manila because they're also there. They also visit. And that's the kind of setup that we have in our facility, wherein there's really a continuity of care happening.
So
And
for patients here, it's not like you have to be seen by a physician or a specialist here, and then if you should have to go to the PI and avail of your services, you start all the way over from scratch. You're
yes,
basically being taken care of across the spectrum.
that's true. And we've provided some of the facilities here direct access to the electronic medical records. So they can actually look into your records. It can be real time and would be able to get to know of what's happening with you while you're in the Philippines and get to connect with your doctor there in the Philippines. So doctor to doctor relationship has greatly improved. In the same way, tracking of the results and having access real time to your records have greatly improved. So these are the things that made it easier for the patient in terms of his or her actual journey going to the Philippines and back here. So I guess that's a selling point. The actual patient experience has greatly improved.
And Dr. Casala, if I may, the actual process of screening, like myself, I turned 50 last year. Colonoscopies have actually for men have been reduced from it used to be like 50, right? And then it was 48, and now it's 45. Right?
Yeah, well, our wellness checkup is focusing more on predictive medicine and early diagnosis, because otherwise, if it's just the usual executive checkup that you see in other institutions, then it's not very useful. The reason why you want to have an executive checkup is one, get the early diagnosis if you're suffering from a disease, predict what's going to happen to you depending on the results that you get every year. So this is what we call a predictive medicine and early diagnosis checkup. So we have this test like, for example, spot mass, which will detect early if you are prone or you have early cancer. And with regular checkup as well, the laboratory results and findings using predictive medicine based on studies on different people, we can predict what will happen to you in the future, and we can prevent that already by providing lifestyle changes, medication, and frequent screening tests to detect where exactly is the cancer coming from. So
Early detection is so key.
yeah.
Yes.
So you're like, for example, this is spot mass test is a test that uh, detects circulating DNA from very early cancer in the colon, in the intestines, in the pancreas, in the prostate, in the breast, and in the liver. So if it is detected by the spot mass, then, for example, it says you have a circulating DNA for colon cancer, then therefore the doctor will have to be very, very detailed in doing the colonoscopy because it's still very, very small. And even if you don't see it, because there's already a circulating DNA, it means that you have to do your colonoscopy much shorter rather than, let's say, the recommendation is if it is negative, you do it 5 years after. But if the spot mass is positive that you have an early colon cancer, then maybe you can do it after 6 months or every
monitor
year if you don't
monitor it.
find it. So you can detect the cancer early and treat it early.
And one thing I've always appreciated about the medical city and you gentlemen and your colleagues is the technology there is state of the art and the techniques are world class, like I said. And
Yeah.
you'll be soon rolling out some robotics, and I'm sure you know when it comes to surgery, the incisions are more minimally as invasive than they have been. And I mean,
So
with respect to the both of you in your training, and a robot is probably more precise.
robotic surgery is basically laparoscopic, but you now have the machine to make it really precise and make the field really, magnified so that the surgeon can easily do the procedure and do not miss any thing to remove. And at the same time, it will lessen the complication.
So the surgeon will instruct the robot what techniques to perform, and then the robot will do it to perfection.
So they will always say, is it the robot doing the procedure? So it's going to be the surgeon just watching there and the robot doing the whole thing. No, it's not. The surgeon would be probably 2 feet away from the actual patient. And you'd have microports, little hands inside the abdomen, right? Inflated abdomen. You have good visibility of everything there. Now, you did not have to excise the whole thing with a huge excision and open it up. It's like minute holes are created in your abdomen. The surgeon now has full control of those instruments inside the abdomen. He's just 2 feet away. Whatever movement the fingers would be doing, the surgeon's fingers, would now be animated by the robot inside your abdomen. So it's still the surgeon doing it, but the surgeon is off the field.
And any resultant like scars would be less. Is the recovery time faster? For
Definitely.
Yeah.
So that's the advantage of having such a procedure because recovery time is much shortened.
Yeah.
There's safety, it's unparalleled. And of course, it limits the complications, possibility of complications happening.
Doc, what kinds of procedures does this robotics technique like?
Yeah, well,
typically, what do they
the most common procedure that is now very popular is for prostate cancer. Prostate cancer, because doing an open surgery for prostate cancer is very bloody, and it's very difficult because you cannot look under during the procedure. But with the robotics, the camera can look and magnify everything, so the surgeon will have an easier time to remove in total the prostate cancer. And at the same time, when the surgeon has a little tremors like that, the robot will address that. So that
Can I ask you, gentlemen, because we live in a world now where the terms artificial intelligence for many different industries tends to make people like a little bit nervous, but for the work that you two gentlemen and your colleagues do and everything like that, how liberating, how satisfying is it for you to be able to save lives? with that
AI
technology?
really helps a lot in making sure that we don't miss anything and we get to get the results earlier. For example, in radiology procedure, because of AI learning over time, different images can be read by the AI, so that when you have a lot of X-rays, the AI can give an initial reading, and the radiologist can look into it and confirm whether that's also his reading.
So it somehow builds on added confidence level in terms of accuracy of certain diagnosis, right? But the actual doctor is still there. The actual clinical eye is still there.
It's supplementary, not replacement.
Yes, that's it. That's it.
For example, AI has been there for a long time, like the simple electrocardiogram. Before you do the electrogram and then you read it. But now the electrocardiogram machine, when you get, there's already a reading there. And then just have to look whether is it really correct or not. Or if you're not a cardiologist, for example, you're a general practitioner, once you get the ECG and you get the reading there, then it helps you a lot.
Okay.
Right.
Well, again, the contributions that the both of you have made to our island community and to the practice of medicine overall, certainly are not going unappreciated. And we thank you, both of you gentlemen, for being here.
Thank you. Thank you.
Thank you, gentlemen. This is Mossy.
Health Check is brought to you locally by Island Cancer Center.